The what? The concha. Alright, so these are all our concha right here. This is very good. Alright. So this is very, very good. Isn't that
Histo one?
So these are the concha right here.
They should be on
And
there.
these are the sinusoidal species. So all of these right here, these are massive sinusoidal species. So these sinusoids have very, very thin walls. So the veins, they don't have any internal or external elastic membrane when you look at those. But these are sort of very modified type capillaries. So where, for example, arterioles, rather than coming into a capillary plexus, may break directly into these sinusoidal species and join back into arterioles again. Alright? So these are some large species here, and these are our sinusoidal species. Now, just give me a minute with this slide. Let me just put on a very low power here. Alright, put it on a very low power. Give me a minute with this slide. So you can see this nasal cavity is very complex. You can see from all of these concha here. So there's a lot of concha in this nasal cavity right here. Lots of concha right here. Okay. But what I'm going to do, when I take a break, I'll take back up this slide again. Because it will take me a little time. But apparently I did find olfactory epithelium on this slide, a good example of olfactory epithelium, and I sort of marked the slide for it. I need to look back at it again. Alright, let's move on, and I'm going to move into now cardiac muscle. Alright, so let us now look at cardiac muscle and moderator band. Okay, cardiac, right, veins. So let's look at a vein. I don't know how this one looks.
Oh, that's pretty. What's that?
So, well, this vein is not looking very good at all. But this is an example here of a vein. So, but not a very good one at all. The staining is very poor, and we compare this with the artery. So that's the aorta right here, and this is the inferior. That's the aorta right here, and that's the inferior vena cava. Well, let's look at hypo. Maybe it's not too bad. It doesn't look really too bad. So there we can see the wall of a vein. So the surgeons, when they go in to operate, they are very careful of these veins, especially the inferior vena cava, because if we go accidentally and tear into a vein like this, then we're in serious trouble. Alright? When you compare this to the thick wall of the artery, this vein, the wall is extremely what? Fragile. Alright? So we wouldn't want to be ripping into one of these vessels here. So as you can see, the wall of the vein is what? Very thin. Okay? Very, very thin, the wall of the vein. So there is a tunica intima with what? An endothelium. There is a tunica media, and there is an adventitia. However, the tunica media is what? Very thin, very reduced, has a very small tunica media. And we see an absence of the internal and external elastic membranes. Now when I'm dissecting the body, what I notice about inferior vena cava is that the adventitia, believe it or not, is considerable. In fact, you can clear off and clear off and clear off, and all you're clearing off is this felt-like adventitia. So it has an adventitia. Okay? So the adventitia there we see is this loose connective tissue layer, and we see now that the tunica media bears no real resemblance to what we saw in an artery. It's very reduced, so the smooth muscle layers is very, very reduced, and the tunica intima is adherent. Okay? So the vein is very different in looks to the artery. Let me look at another slide. Okay, so there's a lymph node right here. So these are the mesenteric vessels right here. That's a nice example of the lymph node. And once again we see the vein, but this is a better looking vein. And as you can see, we see the artery. Okay, so that's the artery we're looking at here. So that's the artery with a lot of sympathetic nerve fibers close in relation to it. Alright? So in fact, right around, that's what's the anatomy of it. There'll be a lot of sympathetics traveling with the aorta. And there we see the lymph nodes, maybe some para-aortic lymph node. And there we see the inferior vena cava. So this is the largest vein that we're going to encounter in the body. Okay? And I can see the endothelial layer. And you see the structure of the vein. So Roy, what about these veins if we encounter them in surgery and we rupture them? Is that a bit of a bad thing? A lot of trouble. Serious trouble. Alright. So there we can see the endothelial layer right here. That's the endothelium right here. And we can see the squamous cells, these flattened squamous cells, these endothelial cells. In fact, in this case now, the nuclei are very long, attenuated nuclei. And the tunica media, there is no internal elastic membrane whatsoever. And there we get the tunica media. This tunica media is very, very thin tunica media, and it seems to be quite broken up here. Alright? Quite broken up here. That's artificial, it's an artifact. Okay? But that would be the tunica media. And then outside of this would be an adventitia. Alright? So there is your vein. Okay, we now move on. I move now into cardiac muscle. Okay. Now, alright, so you're also responsible this term for cardiac muscle and moderator band. That we need to know. Alright. So this is a slide here of cardiac muscle.
I see what
So
you
this
mean.
cardiac muscle here in this slide is very densely packed. Very, 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 very dense. So we know that the heart has an outer layer known as the what? Think the outer layer of the heart. The outermost layer. The outermost layer. The epicardium. The what? The epicardium. And what forms this epicardium? What forms this epicardium?
I don't know.
What will form the epicardium? I'm waiting. Have we got any lectures on the heart yet? Yes, we've been lectured on the heart. And its histology.
Didn't we get one?
So what's going to form this epicardium? Kim. Two Kims sitting there, either one of them. The visceral layer of the serous pericardium. So the pericardium has a what? A fibrous layer and a serous layer. And there's a parietal and a visceral layer. This visceral layer is reflected onto the heart to form what is referred to as the epicardium. Okay? Then we get what? The myocardium, and we get the endocardium. Okay? And in reference to the endocardium, we have a man named E.S. Solomon.